Welcome to Your Health. Information about today's top health topics direct from Brigham and Women's Hospital experts. We want to remind you that this information should not replace the advice or recommendations from your healthcare provider.
Hi, my name is William Camann. I'm the Director of Obstetric Anesthesiology at Brigham and Women's Hospital. We're here today to talk about ways that you can have a safe and comfortable delivery. Whether you're a first-time mom or a veteran mom, the desire for a pain-free labor and delivery is one of the oldest and commonest of concerns among women. Many options are available, including both medical and non-medical techniques for pain relief. The good news is that you don't need to choose one or the other. Many of the methods are compatible with each other, and you can tailor this to your own personal desires and needs. With regard to the medical options, the most common technique is called epidural anesthesia. Epidural anesthesia is used by roughly 75% of women who deliver their babies at Brigham and Women's Hospital. This involves a small plastic catheter which is inserted into the lower portion of your back. It's a relatively painless procedure. A small amount of local anesthetic is injected into the skin of your back, and the catheter is inserted through this area, which is anesthetized. Shortly after the catheter is inserted, you'll begin to feel some numbness in the lower portion of your body, and this will last throughout your labor. The epidural anesthesia is very flexible. Most of the techniques which are used today at Brigham and Women's Hospital are what are called patient-controlled epidural anesthesia. This means that you have a small button attached to your epidural catheter, which is next to your bedside, and you can press this button when you feel you need additional pain relief. This allows each person to titrate their degree of pain relief to the specific desires and the pain experienced during your particular labor. The epidural anesthetics which are used today at Brigham and Women's Hospital also allow a fair amount of mobility. Although women are not actually getting up and walking around out of bed, they do have the ability to move their legs, to sit up in bed, to move around, and to help with pushing and the actual delivery phase of the baby. In the event that a cesarean section is required, the epidural anesthetic can also be used by giving a stronger dose of medication, which will allow you to be comfortable and pain-free during the delivery. With regard to non-medical options, there are a variety of techniques that are available. For example, many people find that water is very soothing and comfortable. You can sit in a tub or take a warm shower, and this is very soothing and relaxing, and many women find this to be extremely beneficial during labor. Many women also use hypnotic techniques, which can be learned as an adjunct to most of your childbirth education classes. And many women also will employ the use of a doula or a professional labor coach. One of the nice things about doulas is that they are perfectly compatible with virtually all of the medical types of pain relief. You can use a doula and also have an epidural anesthetic, a technique that I call an epidoula. This will allow you to get the emotional support and reassurance from the doula, as well as the excellent pain relief from an epidural anesthetic. It's a perfectly compatible and very nice way to experience labor and delivery. The bottom line is that one of the most predictable things about labor is that it's unpredictable. You should be prepared, be flexible, learn what your options are, learn that modern medicines are very safe, that a variety of complementary and alternative methods are also available, which are also safe and effective. Don't feel guilty about choosing one particular technique or another. Your obstetrician, midwife, the nurses on the labor and delivery unit, as well as the anesthesiologists, are all experts in helping you decide what would be best for pain relief during your particular labor. And they will help you achieve a safe and comfortable labor and delivery experience. Thank you.
Thanks for watching Your Health from Brigham and Women's Hospital. A reminder, Your Health is intended for educational purposes only. It should not take the place of advice or recommendations from your healthcare provider. If you have questions about what you've heard, please consult with your doctor.